Now get ready for the top secrets, tips, and tricks to enhance, elevate, customize, amaze, and leave your clients wanting more. With our experienced massage therapist instructing you to heal and relieve aches and discomforts of the everyday technology jobs. Massaging since 2005. A massage therapist at various chiropractic offices. Franchise massage stores such as Elements, Hand and Stone, Massage Envy, Massage Green, Body Center, and now with the fabulous Massage Negotiator, a bachelor's from UCSD in economics and math, a master's of science degree in data science, a plan to create an AI self-help diagnostic tool to identify common pathologies by symptoms while spending 3 years in a cultic chiropractic medical school, and more stories of healing than welcoming people to die with an idiopathic disease. Saved her dog after it was crushed by a drunk driver by nursing it with mild stretching, massage, and boiled eggs. Also, antibiotics from veterinarian. Welcome, the fabulous host in Face Blur, and get ready to be amazed. While we wait, please stop to think out loud the following. You are a self-healing, self-repairing, loving, amazing, wonderful, smart, caring, nurturing, creative, strong, and enthusiastic person. You have the power to build yourself up and others. Teamwork makes the dream work.
From Costco. But look how great it looks in here. I spent about 4 hours cleaning it up. I patched all those wall things again. That took like 4 hours also. I didn't paint over them yet. So I'm going to sand those. I rearranged that. It was right there. Dusted everything other than what's on the wall. Put a few different pictures there that I had from up there. This was coming off, so I tore it off. But these magic erasers, the generic from Aldi's, this is what I use. And I got 4 more boxes, but I used like 2 boxes already, and they come with 2 pads each. And they're only like $1.60. But look how great it looks. And those were the sampled paint things that I left. But I was able to scrub off all their dog saliva and dog fur. Look at this door, though. Look at the door. Doesn't it? It looks great. And then behind the door, all the baseboards. That's also another paint sample. I didn't paint the wall. And then all the little white trim. All of that. Yeah, and the walls. 4 hours with these guys. I recommend it. Plus this generic cleaning spray. But yeah, these things are great. If you're gonna do some deep house cleaning, you're gonna do the wall and the trim, especially when you have dogs. Patch all this stuff up. I want to get some metal sheets to cover that up. Alright, great.
No. Alright. Okay, Sheila, at any time, should I lower the stick still? Because I want to make sure that you're not doing like a nice lordotic curve. How do you feel? What if I lower it a little bit? How's that? Yeah, I think that's good. Okay, cool. I'm just going to lift your necklace up a little bit just so I can work around it. Alright, and I'm using lotion. Yesterday I used the wrong thing with you. Yesterday I was using lotion in the car and I used this. But if you want it when dirty, I can have it.
It's okay. It's whatever is gonna help because it's really good. And you're the only person I know that knows stuff about this.
So I can actually slide this into your back. Because it's only going to be active for 20 minutes.
Wow, Bailey.
Oh, Bailey, how are you doing? Good, how was your workout?
Looks good. I haven't been to the gym in a while, so.
Oh, nice. Oh, cool. Are you guys going to start working out together or you never have?
Yeah.
You go to the same gym?
Yeah, but
disrupt your spinal thalamic tract. What's happening is it's sending sensation faster than pain sensation. Because pain goes on a slower, less myelinated nerve fiber, which means that it's slower. It can be on the A delta, which is the acute pain. But if it was chronic pain, it would be C fiber, which is the slowest fiber. And then temperature, like hot and cold, with pressure, and working out, like contracting the muscle, those are gonna send sensory different. How is it going, Sheila? Awesome. We're just putting some heat on Jordan's back. Oh, it hurts? Yeah. Is it kind of helping with the pain?
I think so, actually.
Oh, awesome. Yeah, so it's blocking the sensation of pain with the temperature. It's faster. Great.
The boys.
They're not tired though. You're like, how did you do that long?
No one was tired.
No, he was not.
You shut up and put up the bed.
No, the second I walked in there, he started laughing and he wanted to get up.
Because he saw you.
They're so cute. You're really good with them. Who is this? Is that yours?
Yep. Bye, Tila. No one else's.
Tila and Sheila.
Yeah, I'm Sheila, Bailey. I'm Tila.
Hey, Sheila. Okay, let me just kind of rub your hands on my hand just so we can wipe that part off, and then I'm going to massage your hand. Because the road is a little bit, yeah, so you can just slide up here.
Now we do the belly massage, great for digestion, circulation, immune stimulation of lymphatic system, and palpates tenderness that can point to injury to viscera in abdominal cavity.
First, get a couple large pillowcases to place over client's chest to secure modesty over blankets, while pulling blankets down to expose abdomen.
Do not expose client's breast tissue while securing pillowcases over blankets and pulling down blankets to expose client's belly while keeping breast tissue covered with pillowcase covers over chest. Stop pulling down the blankets once you reach client's underwear line or a few inches below belly button. Do not pull client's underwear down to expose more lower belly.
Alright, so here's your belly button. Right here. I'm gonna go.
The abdominal massage is not common, but is common in those post-liposuction with abdominal pain, slow gut motility, or aches in abdomen related to constipation. Promotes arterial and nerve circulation to the superior and inferior mesenteric plexus and pelvic splanchnic nerves supplying the foregut, midgut, and hindgut. Start below belly button, moving 312 strokes from left to right, moving gut contents from small intestine to large intestine or ileum and jejunum to large intestine at the cecum of ascending colon. Then move from cecum of ascending colon, right of belly button, up to hepatic flexure of colon, aka large intestine transverse portion, effleurage. 312 strokes. If tender, or feel bumps, lumps, or client reports pain, then it could indicate a blockage or visceral damage to liver, gallbladder, intestines, or appendicitis. If in the right lower quadrant, move into 3 to 12 strokes along transverse colon to the left upper quadrant of the splenic flexure. Pain or tenderness could be due to recent viral or bacterial infection, sickle cell anemia, leukemia, constipation, ulcerative colitis, or diverticulitis. Then move downward, left of belly button, along the sigmoid colon from splenic flexure 3 to 12 strokes, and repeat the cycle. Should be relaxing, but pain can indicate in left lower quadrant ulcerative colitis, diverticulitis, constipation, female uterine disorders, and others.
Anytime. Does it feel uncomfortable?
No.
Okay. I'm actually just gonna Alright, so this is where your liver, the hepatic flexure is when it goes ascending transverse. And here's the splenic flexure. Transverse to descending.
Sorry.
So, Paul? Yeah. And then I'm going to reach under, because this is going to get into your stomach right here. And then I'm going to curl. Just do that sometimes. And that helps also to stimulate blood flow, lymphatic flow. And the digestive tract is supplied by 3 different plexuses of nerves, inferior, superior, mesenteric, and splenic nerves, which also have arterial supply. Interesting, huh?
Yeah.
And end with the cycle around the transverse colon. Is it relaxing?
Yeah.
Holy shit. Now,
That's better.
Deep tissue massage.
Slowly going through all those
Use forearm edge of elbow to dig slowly, deeply, and cautiously into the paraspinal muscles of dense, tightened, soft tissue. Caution the bony prominences and ribs to avoid those bony regions of body with deep tissue massage.
Check in with pressure and strip the paraspinal muscles deeply bilaterally, moving away from head or towards head or both. Relax the client by adding pressure through thick layers of soft tissue, squeezing the sympathetic chain and inhibiting stress. Response to enter parasympathetic response. Try this out.
Adding a broad, flat area of deep pressure with your body weight. Use more pinpoint elbow if you have super tight, dense tissues that need more give or if client cannot feel it. You will notice redness and heat generate if client's body responds well, but not redness or heat if client cannot feel it. That could be due to scar tissue, blocked nerve and vasculature that is limited as the body has other conditions like degenerative disc disease, arthritis, facet syndrome, bulging disc, and so on that have been built over by the body. That or they are on opioids and can only feel pressure of body but not the direct touch sensation.
You know, like whenever you work out muscles really heavy or
Yeah.
cool, it's a nice color right there. Now we're gonna take actually this is a specific instrument assisted soft tissue mobilization. It's kind of cool to touch out.
Metal
here,
guasha
but it
scraping
curves around for the body, and there's
help
specific
bring
edges where
blood
you can
circulation
right
through
here.
all the dense myofascial and muscles of paraspinals, from arterial branches of the thoracic aorta, deep to the spinal column. This is a great way to initiate the healing process of breaking down old scar tissue and initiating the 5 cardinal signs of inflammation: redness, heat, swelling, minimal pain, and minimal loss of function. Some redness may show and stay for a few hours afterwards. Use oil to avoid skin abrasive friction burns with tool. Move tissue away from bone, where dense, less vasculature tendons and ligaments are, and into the knots of the muscle and myofascial of paraspinals, rotator cuff muscles, and postural muscles. Notice the deep redness. Stay off the bone. This is superficial and fast strokes to bring in blood flow and healing. The redness comes and goes. If it stays, you messed up big time because you burned their skin. A few hours is okay. Some petechiae is okay. You have to break up superficial lesions around the tendinous attachments and get blood to those regions of body. Hold down the bony areas and move away from the bone along the tissue. You will feel the give and knots as obstacles, speed bumps, popcorn bumps, and so on. Do this 10-15 minutes to enhance massage healing outcomes.
Okay, let's go back up or down to the lower back. How's that? Is that okay?
Yeah.
The babies are so cute. I love them.
They are cute.
Let's do it a few times. It's getting circulation, so that's good. You do want to use some kind of oil lotion lubricant on the skin just so you don't give it a rash, because that will hurt, you know? And you want to make sure it glides. And you can just press firm in there and feel the knots like speed bumps under it. Just popping. Nice red color in there. Great. You can turn to the other side. Let's know if it's hurting, okay?
Okay.
And you don't want to go too fast because remember, you do not want to run into the spinous processes. And the skin can move over it too. So right here, I just moved the skin. They call it tissue slack right over the spinous process. So even though it's white right there, I'm on the spinous processes because I just moved all that skin right there. Okay. Which just means you could get in there closer. But you don't want to like bruise the bone or anything, you know?
Yeah.
Cool, nice red color. Might be time for going back to the massage. I'm just gonna dig in there now with the neck.
sometimes wow. If it gets really tight, we can also go into the subscapularis. Let's do that.
Pay attention, great. Now this right here is a trick to getting into them, their rotator cuff and postural muscle attachments. The medial border of scapula runs along the scapula and involved in shoulder internal rotation while stretching the external rotators of scapula ad infraspinatus and teres minor. Many folk expect to have this done and many cannot do this. So make sure you don't hurt them as they have old rotator cuff. Injuries that limited external rotation, add too much and extension, and is most common way to dislocate arm at the glenohumeral joint.
This would be serious and is no laughing matter.
Alright. Because it is pretty delicate in here. But your subscapular muscle attachment right here, if it gets tight, it could be feeling like a puppet string right along the acromion process right here as you palpate the clavicle right here. It's the border acromion process right here, subscapularis. The supraspinatus tendon comes through here.
Question. What is the most common rotator cuff muscle to be injured? The supraspinatus tendon is the most common injured rotator cuff injury as it passes under the acromion process and attaches to the anterior arm to lift the first 5 degrees of shoulder abduction. This can be tendinitis that scars over and eventually turns into shortened and weakened muscle fibers that rupture in old age when sleeping incorrectly or with overuse of arm at the shoulder.
Sorry, is it okay? Yeah. Alright. Let's get a pillow to put under you so we can elevate your arm to do this, okay? Okay. And I have one right here. Right here. I'm gonna actually...
Quiz time. Yay! Hooray! Let's reinforce these secret tips and tricks to massage therapy and healing.
hope you enjoyed this video. Look for more continuing education hour credit videos in cupping, myofascial, hot stones, prenatal, sports massage, deep tissue, cold stones, lymphatic drainage, and more. Keep up the great work.